Okay, the second question is that my daughter has a vagus nerve stimulator, had ketogenic diet for 1 year, and she is currently on 4 anti-seizure medication and continues to have seizures, mostly while sleeping. Are there any new procedures or medications that help with refractory epilepsy? She was evaluated for surgery at Miami Children's Hospital in 2008 or 9, but was not a candidate. So first of all, I'm very sorry that your child has a very difficult to treat epilepsy, and unfortunately she is truly refractory to all kinds of medication, vagus nerve stimulator, and so on. Now, the fact that your daughter was evaluated at Miami Children and was considered not an ideal surgery doesn't mean that it is completely impossible. Meaning that when we have a child who have difficult to treat epilepsy and we evaluate them, sometimes we may make a decision, say, hey, you're not an ideal candidate because as a result of surgery you may end up giving additional neurological deficit and so on. However, when you have really desperate situation, meaning that the seizures are very, very disabling and even medically dangerous, sometimes you may have to make a somewhat difficult decision. In other words, have to consider taking a little more risk involving potential neurological deficit and so on. But our overall long-term goal is to improve the quality of life. So to try to explain a little differently, the situation could be that your child may not be ideal candidate because we may not be able to give you 100% guarantee or a certain seizure freedom rate, but we still might be able to offer some improvement in quality. So in that case, I think that surgery could be justified, and it's really depending on how grave and serious your child's epilepsy is. So I'll be happy to look at the data more carefully if you have the data from the other hospital, and we might have to kind of look at the situation more freshly with our own testing and so on. But overall, I think it is worthwhile to have a second opinion if the first opinion was not so desirable.